and thanks for joining us here today. Since day one, I have been clear that the government would implement a healthcare action plan to build a better healthcare system that Albertans expect and deserve. A system that better supports better care for Albertans when and where you need it the most, while setting clear measurements for success. Last month, Minister Copping, Dr. Cowell, and I announced a number of priorities to accelerate the changes Albertans need. These priorities are improving emergency medical services response times, decreasing emergency wait room times, reducing wait times for surgeries, and empowering frontline workers to deliver health care. It's been just over a month since we launched the plan, so I'm pleased to be here to give Albertans an update on the progress that's being made, especially on EMS wait times. We all know Albertans are waiting too long for an ambulance to arrive to help in what may be someone's greatest time of need. Starting today, Alberta Health Services will use alternate modes of transportation for non-emergency transfers of patients instead of using ambulances where it's clinically appropriate to do so. This will free up ambulances and paramedics to respond to more emergency calls and to provide urgent care faster. It's important that these highly trained professionals can deal with actual emergencies and not shuttle patients from one place to another. This program has already been successfully piloted in a number of municipalities: Calgary, Bonnyville, Valley View, Athabasca, and St. Paul for 6 months. The result of the pilots have already been clear. The program diverts 15% of ambulance transports, which will allow for an additional 70 responses a day province-wide. That means 70 more possible ambulance trips for actual emergencies every day. It allows our world-class paramedics to do what they were trained to do. And even more importantly, lives will be saved because we have more ambulances available to respond to emergency calls from Albertans, bringing paramedics to administer their excellent and life-saving work. I'm confident that this change will mean reduced wait times for EMS services, making our healthcare system stronger and better. And our work doesn't stop there. Dr. Cowell and the team at AHS are doing a number of other things: expanding hours for non-urgent pediatric clinics, increasing supports in emergency departments to support the assessment and discharge of elderly and frail patients, and working with community partners to facilitate safe discharge for individuals experiencing homelessness. This is our healthcare action plan at work, and we will have many more announcements like this one to talk about in the coming months. I'd now like to invite Minister Copping to provide more details about the program.
Thank you so much, Premier. It's great to be here and welcome you all to the heart of Calgary Varsity, Foothills Campus and University of Calgary. I want to start by offering my heartfelt thanks to all our healthcare workers who continue to put the needs of Albertans first during this very challenging winter season. We continue to see an unprecedented strain on our hospitals, which means our paramedics, nurses, doctors, and staff supporting healthcare needs of Albertans are busier than ever. And over the past few weeks, I've been saying that help is on the way. And I'm pleased to be here today to talk about what some of this help looks like and what else we are looking at moving forward on. Let's start with the immediate. As the Premier mentioned, we're taking immediate actions to free up ambulances and highly trained paramedics to respond to urgent calls. We've heard loud and clear that paramedics are getting tied up with transports that don't require their skills or an ambulance. We need more paramedics and ambulances, and we need to free up the ones that we have right now. We're seeing a sustained increase of up to 30% in 911 calls, and the system had limited slack in it before. On top of that, emergency departments are seeing high volumes of very sick patients, so paramedics are waiting longer in emergency. There's no EMS system that could deal with this situation without real strain. The fact is, response times are too long, and we need to get them back down. So we're adding capacity, and we're looking at any new option that can help. One of those options is using other vehicles and staff to transfer medically stable patients who don't need an ambulance. It's not a new concept, but it needs to get scaled up. We have asked Dr. Cowell to do that urgently, and we're here to talk about the plan to make that happen. Now, I'll leave the details of this to Dr. Cowell, but this program will help bring down EMS response times as more ambulances become available for more calls. And it will also help free up hospital beds because patients need transport in order to leave, and some are just waiting for an ambulance. If they don't need one, they shouldn't be waiting for one. Non-ambulance transport will help, and at the same time, we'll keep moving forward on other solutions and adding capacity as fast as we can. We're putting more ambulances and more paramedics on the road, and it's helping. To take just a snapshot in time, AHS had 5 more ambulances on the road in Calgary at the end of November on the day shift, compared to 2 months earlier and 3 more in Edmonton. That's about a 10% increase. And we're supporting AHS in adding staff. The system has 450 more paramedics than 3 years ago. That's about an 18% increase. AHS is looking at any and every option to find more staff, and will rely on Dr. Cowell to help drive that work forward. And we're seeing some improvements in response times compared to the peaks over this past winter. AHS is making progress, in particular on reducing trips into Edmonton and Calgary from the surrounding communities, and as a result, their response times are improving. In Edmonton itself, the latest median response time is right around the 8-minute target, or just a bit above. In Red Deer, it's right on the 8-minute target, and it's below the target in Fort McMurray, Grand Prairie, Lethbridge, and Medicine Hat. Now, we're still struggling here in Calgary, especially because of the challenges that we're facing in emergency, and that's a system problem, not just an EMS problem. We need more capacity to get patients out of emerge faster and free up the staff for the next patient coming in with EMS. And some calls are still taking far too long right across the province. So we need to do more, and that's what today is about. It's just one more step towards our goal. And as I've said before, we're going to work at this until we get those response times back down to within AHS targets. Now, this is a big issue, and it's going to take time to catch up, but we're going to continue to work on it until we get there. And at the same time, we'll continue to add capacity right across our healthcare system. We're doing that in surgery, for example, with new clinics and new operating rooms in hospitals doing more procedures, and with new approaches like central intake and rapid access clinics for orthopedic patients. Adding capacity means adding skilled people. So we're also working on a broader health workforce strategy, building on what we've already done, and we're going to be releasing that new strategy in the new year. And we'll continue to work to build capacity within our system and looking at strengthening our primary care system. In September, we created 3 advisory panels to look at how we should modernize our primary care system. These panels are hard at work, and I'm looking forward to seeing their initial recommendations. And I'll have more to say on that in the new year as well.